So, without further ado, I want to welcome our guest tonight. Uh, you know, she's a former president of Royal College of Nursing and dean of the Florence Nightingale faculty at King's College in London. She's currently serving as a baroness in House of Lords. And not by like ancestry, but by actually something that was deserved through the career and amazing things that Anna Marie did in her life. And our conversation tonight, as usual, will go in two parts. We'll have a chance to I will ask some questions, and then we will open up for the conversation for the rest of the group. So, Anna Marie, welcome, and we really have a pleasure and privilege to have you here with us tonight. And thank you so much for joining us in such a late hour. So, welcome.
Great pleasure. It's a privilege for me too to be here with you.
Yeah. So I want to start with the question that you spent your career at the intersection of history, scholarship, leadership in nursing in different shapes and forms. And if you had to describe the current state of nursing profession in one word or a few words, what would you say and how would you describe that? Like, let's start with the immediate. Like, where are we right now in nursing, if you look at it from your perspective?
Well, sorry to start on a negative point, Peja, but I think the word I'd use is stressed. I think the profession is highly stressed. And I mean, that's not necessarily a new thing. And we could talk about that, the kind of long trajectory of pressure that nursing's been under. But as exemplified by the State of the World's Nursing Report produced by WHO, the first of which was only produced in 2020, may I say, we are short of many nurses. We need it somewhere in the realm of 29,000, and at the moment we're 29 million, and we're 6 million short. And the projection is that by 2030 we'll be 10 million. The world will be short of 10 million nurses. So, that deficit in itself creates workload issues. And in a study which I was privileged to do with my great mentor and collaborator in the US, Professor Linda Aiken from University of Pennsylvania, we did a study of nursing in Europe a few years ago, and we kind of updated some of that more recently, a different type of intervention study. But, there's huge variation in how our hospitals, this was mainly hospital-centric, are staffed. Even the same types of wards, there's no rhyme or reason or rigor to it, where variation was 1 to 11 in some and 1 to 6 in others. So even where there are comparable demand drivers, we see this variation. And when you consider that in somewhere like California and in Australia, where they've set standardized ratios for nurses, that ratio of, general medical and surgical units is 1 to 4. So, most of Europe is operating within that margin of shortfall. That this is really why nurses are severely stressed. That's one of the reasons. And as you know from your own experience and evidence in public health, population health, with more and more people aging and developing multiple comorbidities, the complexity of managing care as well as the volume is intensifying. And that's, the fact is that people require, care after acute medical intervention. The reason that they stay in hospital beyond an allocated length of stay is because they need nursing care. And that demand's going up, and the supply of nurses is not keeping pace with that. So that creates all sorts of stresses. I could cite more evidence. We've done this another study during the COVID called NHS Check, which was a longitudinal study of all health professionals. In fact, it was all healthcare workers, everything from porters to consultants, doctors, what you would call resident doctors. And nurses, particularly young nurses, were the most vulnerable to depression, to anxiety, and suicidal thoughts and ideation. And that's a very serious problem. Actually, nurses have amongst the highest rates of suicide in of amongst our professionals. And, that hasn't actually declined with COVID. So it's very worrisome in the longer term. So, all the indicators, they're not really going from the UK's perspective, and including some European countries, in the right direction. So maybe I'll just leave it at that, but it's a serious and unsustainable situation that we're in.
Anna Marie, thank you for that reality check and kind of being direct about it. I'm curious about, one question that pops to mind, because you have such a vast experience yourself, like going from doing the work to teaching other people to getting into like more of a politics that you are part of right now, of nursing. So was it always like that? Like, one could argue, like, wasn't that always the case for nurses? Like, and was it that the whole profession was always somehow like in the shadows of doctors and being like, well, I don't want to go and use the words oppressed, but like somewhat like discarded in many ways. So like, why is it different right now? That's my here.
Well, I don't think we've had as much data on the mental health of health professionals and nurses. COVID really shone a spotlight on the quality of life and mental health, in particular, morbidity of health professionals, and nurses became part of that picture. And mainly because, these are predictors of people leaving the profession, and that is very bad news overall because of its costliness, first of all, but it's the human cost as well as the economic cost, both to the system, because we actually know very little about what these nurses do after they've left the profession. But that's another kind of question. Have we been in this situation before? I think that the way the situation is framed is slightly different, Pedja, because way back, in the interwar period before the National Health Service, at least in the UK, and it studied some of this, nurses were part of the labour system of hospitals. They were basically underwriting the costs of our hospitals and subordinated to the service needs of the hospital. That was through training. Training was really an opportunity to use nurses as pairs of hands to provide domestics work, often, cleaning, making sure patients were not only looked after, but also the environment was brushed, the floors were mopped. I mean, my mum was nursing during World War II and before that, and she was telling me how they had to dust and move these hugely heavy beds, and dust under the bed. There was an obsession with cleanliness, and it was nurses who had to do this. And the amount of domestic work was heavily criticised in a series of reports because it was regarded as, it was masquerading as education. Of course, it's not education. It was just using them as a labour force and substituting for employing and paying extra domestic staff. So that exploitation and subordination was something that reformers started to react against, said that, this isn't education. We want nurses to be properly instructed, and that time to be usefully and productively invested in learning new things, not repetitive tasks and, domestic labour, which should be done by others.
Yeah, that is really, really fascinating. And one thing that comes to mind when you speak about the stress and especially that type of, you use that word to describe the state of nursing right now, I do wonder what I see and my interactions with in our community and beyond, is that it's not just that nurses in this moment in time are still providing great care, like with a lot of empathy to their patients, like probably the most within the whole system, if you look from that perspective. But it's also that we are seeing more and more, many of them stepping into advocacy roles and actually doing amazing work in changing the conditions. So where do you think, like in your experience, where's that moral compass coming from? Like what's the source of that for nurses now? And What you're seeing many stories, much more than I am, like in terms of like possibilities that are in front of us. So I'm just curious about where do you think that comes from, and what can, how can we celebrate that in.
Yeah, the moral compass is a very helpful phrase, I think, Pedra. And you know, I could be very idealistic at one hand and perhaps romantic and say, well, it's part of the DNA of nursing, and if I was to criticize that view, I would say, well, that's very stereotypical, isn't it? And all nurses are motivated by this kind of core principle. And of course, that again was exploited in the past because nursing, and we still hear it today, it's a vocation. People, you don't do it for the money. I'm not in it for the money. No, but people have to be well paid, well remunerated. We have this big problem in nursing where nurses feel really undervalued. And that's not exactly a surprise, given that a lot of nursing is actually rather, at least in our country, poorly paid. For example, 60 odd percent of nurses, peoples rather, who are on the lowest level, which is about £28,000, maybe, I don't know, that translates into about $35,000 to $40,000. We are by far the majority of the workers, health workers, who are on this lowest grading. That is an absolute scandal and a disgrace. And people get stuck there and they're not able to progress because nursing is used as a way of balancing the books. So, I think it's all very well dressing up nursing as being, part of this kind of great moral crusade and enterprise. But nurses do have to advocate for themselves because often no one else is advocating for them. And your strapline at the beginning is like finding your voice, but it's really difficult for nurses to speak up in the workplace. And despite a lot of initiatives to help nurses do that, it's still, people feel suffocated, they feel bullied, they feel harassed. There's all sorts of pressures that are applied to stop nurses from actually articulating. And those who do, dubbed as troublemakers, rather than helpful kind of whistleblowers. But I'm polarizing things there, perhaps for effect. There are a lot of nurses who do feel in their heart they are motivated. If I speak to people, our students, they do want to do something that's going to have a material and a tangible impact on patients, their families, and on populations. And nursing is a very practical way of doing that. You can see the impact of everything from making a patient feel comfortable, fixing the pillows behind the neck, putting little pillows underneath the knees, talking to them, soothing them, just taking someone's hand, touching them. These things don't cost a lot of money or time. They're about being attuned and sensitized, and the best nurses do this. They're learned behaviors. Don't believe this notion that it's instinctual. It's, because nursing is highly feminized. These are learned behaviors, and you can see them in the great role models that we have in practice. So whilst on the one hand, I'm rather suspicious of, the moral compass as the kind of essentialist quality and character of nursing, it is something that has to be inculcated and amplified and encouraged where it is, a kind of germ stem cell in nurses who come into the system. It has to be nurtured, and it is nurtured through working in a positive environment. And, positive environments are there, but they're not necessarily the dominant form of environment that we find in healthcare, unfortunately.
Yeah. And it's so important, like which I really appreciate what you're saying about that, even that notion, that thinking about like, oh, there's this expectation. It also like is used to suppress the voices, and sometimes say like, well, but that is who you should be, and you should not kind of like complain or ask for different working conditions or something like that. I think that's important to recognize and to be careful. Yes, there is there's a moral compass that has to be kind of like nurtured, and at the same time, it cannot be at the expense of the nurses who are in the system right now. You know, you did something really beautiful that I honestly, when I talk to people and I mentioned that, I think it's one of the most creative ideas that I've heard like this year. I know you're if you can speak a little bit about that intersection between art and nursing. I know you're a real big proponent that we should think about how do we bring art in the practice of healing. Yeah, I'm just I don't want to steal your thunder here. I want you to tell the story about the amazing thing that you did earlier this year.
Yes, it was. Yes, thanks, Pedro. I mean, we were interested in, we had this project at King's, which was bringing artists and clinicians together. And I just happened to be sitting next to someone who was from the dance world. I mean, it was pure coincidence at one level. We just got chatting and we were all encouraged to do that. And some of us don't need any encouragement, really. We, you know, found out a little bit about each other. And I had also, through colleagues in my faculty, heard about the pressure again that nurses in chemotherapy are under, because, and this was a new kind of facet to the work that I've done in, researching the nursing workforce, and thought, well, that's really interesting. How does that manifest itself and how can we understand it? So we were fortunate enough to get a little grant to go into chemotherapy units and see the pressure that nurses are working under. That is, that they have to, when patients come in, there's so many patients have to be seen in a day. Everyone wants to get their chemotherapy. Well, people don't want chemotherapy, of course, because it can be a harrowing and a very troubling experience. But if you're, on the list, you want to get better. So this is one way to do it. So we went in and we observed the movement patterns of nurses in these brand new chemotherapy unit. And what we were very impressed by was how elegant they were in actually performing all of the actions and the tasks that went to delivering chemotherapy to a patient. Everything from the way they took the drugs out of the cabinet, protected cabinet, the way they applied their kind of PPE, the way that they, administered that to the patient. They kind of twizzled the IV, speaking and communicating with the patient, explaining what was going on, and dancing round as well. You probably have, I'm sure you have it in the US, the computer on wheels, which was quite balletic, but they were doing all of this, and multitasking in actually quite a congested environment without bumping into each other. And we just found this extraordinary. It was so skilled, and dexterous. What we did was we recorded, not with film, but by, in drawing those kind of movements. And Edurna, who was my collaborator, and another colleague, Anne Jones, who worked with us as well. In fact, Anne, who is a faculty member, had also done, ballet herself. So she was in pole position to kind of, understand the kinds of, if you like, the physical elements of the movements as well. And so we took the individual and then vavoomed them into a dance format, which then we fed back to those nurses who were working in chemotherapy, and they were absolutely fascinated and enthused and thrilled because they could see themselves reflected in all of these. And then, we performed the dance together, and it was something that they absolutely loved it. Honestly, they were energized. They forgot about, their whatever else was going on in the day. It took about 15 minutes, to actually communicate and do all the moves And then, of course, Aduna had great music. I mean, I can't possibly do what she did, but just to see it kind of lifting the mood, serotonin, the oxytocin levels of the nurses, and getting them to kind of touch into teamwork with each other, move around with different partners. It was absolutely thrilling to see. And, for them to really see what they're doing displayed as a kind of beautiful thing, something of beauty, that is really aesthetically kind of pleasing and complex. And yet, it's like appreciative inquiry to put that on show and just show them how brilliant they actually are and how skilled in, the work that they do, which is highly embodied. Nursing is both about an embodied work, body work, both of self and with patients, as well as emotional and cognitive and organizational. And it was the organization of those movements and bringing all of those, 4 quadrants together in a kind of quadrille, if you like, that I think is just so impressive about how nurses, how they hold themselves, how they act in practice.
It's really beautiful. And we talk a lot about in the community and in general, we talk a lot about how there's this tendency in modern medicine of dehumanization, like that is unfortunate, that not in extreme forms, but in a small forms that are experienced by both providers and clinicians and patients, is like everybody feels treated as object. When you share that example and that story with me, I remember seeing like, this is the antidote to that. This is how we can start seeing each other as humans, and how we start seeing our practices deeply humanistic in nature and connected, and also to show respect and show dignity and all of that in a beautiful form. Anne Marie, thank you for your even more beautiful answers and with a lot of wisdom and practice and experience. I wanted to ask this last question, and I'm super curious about it. You can answer it shortly. Is it harder to be a nurse or politician?
Oh my goodness. I think nurses are natural politicians. My God, everybody in healthcare has got to be a natural politician because there's so much politics in the workplace. I think it's the ideal apprenticeship, being involved in healthcare. I don't see a kind of division. You've got to manage people in politics. Look, boy, do you need people skills as a politician? Not all political leaders, we won't mention any names, would seem to have them, would seem to have self-reflection, insight, humility, capacity to listen and empathize with others. I'll leave it at that.
That's amazing. That's amazing. And thank you again. Thank you so much for this conversation. Thank you for serving in that role in the House of Lords and in the WHO and the roles that you play globally for the profession of nursing. I hope people enjoyed this conversation. I know I did. And once again, it's a real pleasure, and thank you for being with us today.
Thank you so much. It's been a real pleasure and privilege and fun and interesting and stimulating. So what more could one ask for? Thank you so much.
Thank you, Anne Marie. Thanks, everybody. To be continued.